I'm showing about 10 seconds out. Are we ready to get started?
We're ready.
All right, excellent. When I transfer you over, you will hear music for a moment. I will turn that off, do the introduction, and turn it over to Kathleen.
Okay, thank you.
Thank you. You're welcome. Transferring you now. Ladies and gentlemen, welcome to the Lake Superior Quality Innovation Network Staff Retention from an Independent Owner's Perspective webinar. Your host for today, Kathleen Lavich, will now begin.
Good afternoon. This is Kathleen Lavich. I'm one of the clinical quality consultants at INFO, and I'd like to welcome you to today's webinar presented by Lake Superior Quality Innovation Network. The LSQIN is comprised of 3 organizations: Empower in Michigan, Metastar in Wisconsin, and Stratus Health in Minnesota. And we support the Centers for Medicare and Medicaid Services priorities for healthcare quality improvement in each organization's respective state. I would like to now introduce you to today's speaker. Sharon Hinkle, Nursing Home Administrator, has worked in the skilled nursing facility industry since 1985. Ms. Hinkle earned her bachelor's degree in social work and currently serves as an administrator at Countryside Care Center. She has been working in independently owned skilled nursing facilities since 1997. Ms. Hinkle also worked as a CNA throughout college and has experience in skilled nursing facility admissions and billing. I would like to refer you to the National Nursing Home Quality Care Collaborative Change Package. This package is a collection of 7 strategies to help you in your quality improvement efforts. And this webinar applies to strategy 2, which is recruit and retain quality staff. You can find the link here to the Change Package, which has excellent change concepts and action items that you can incorporate into your quality improvement efforts. I will now turn it over to Sharon. Let me just go over the objectives for today's webinar. To understand the impact of demographics and labor market on CNA and nurse recruitment and retention, and to learn about alternate employee incentives and benefits that promote satisfaction and retention. And now I will turn it over to Sharon Hinkle. Thank you. Sharon?
Thank you. Good afternoon, everyone. It's beautiful outside. I did this presentation about a little over a year and a half at Joint Provider, and it still holds true to a lot of the stuff that I said then, although I don't have adjusted some of it from there. So Countryside is a 108-bed skilled facility that originally started way back in the 60s, and John bought it from his brother in the 80s. When I started here, we only had 59 skilled beds and a 36 home for the aged. Staff that had been here had worked here a long time, and in fact, some staff are still here after 30 years right now, so it has become a big thing. The biggest thing in Jackson now is the competition. I think that's where we're really at now. Jackson is, in my opinion, overvetted at this point. We have 7 skilled nursing facilities, a hospital, a long-term acute care hospital, numerous assisted living facilities, and then the retail and restaurants. So not only are we competing for CNAs and nurses with all of the other health care, but we're also competing now with retail and restaurants from the fact that they're starting to increase their wages as well. So as you know, right now the economy is good, so everyone is hiring people, and it's really hard to find good staff and not have to pay huge amounts. So that's one of the biggest things that's happening in Jackson. We started looking at all of that. Back in 2010, we had a big trend where a lot of staff were leaving and going to other things, so we looked at across the board and did some wage adjustments, and we stabilized out. And in the last year, as probably most of you know, in the last year there was a lot of people just shuffling. They would go from one place to one place. So we started doing the wage adjustments, not call it a raise, but a wage adjustment based on what other companies were doing, the whole economy was doing in this area, and that seemed to help us stabilize as well. One of the things that drew me to this facility when I started here, the dad, John Sr., was running this facility, and he was the administrator. His son had to work his way up through the system. He worked as a housekeeper, a CNA, the kitchen, everything, and when I started, he was the human resource director. As he took me on a tour, he joked and laughed with the residents, called them by name, knew every single staff we passed by name. It was a very comfortable atmosphere, and that is still true today as far as that family-oriented, everyone knowing everyone, joking, that kind of thing. So that's a very positive thing to have in your facility. So I go on the floor every day, joke with the staff, make sure I meet every resident, every family. It's just something that helps the overall atmosphere. So, our customers aren't just our staff or our residents. We also have to think about family and visitors, and that's one of the things I was just talking about, is the atmosphere in your building is very important. And as you all know, the millennials have now come into the picture, and you have to change your ways. The millennials don't want to work full-time. They're not here for the pay. They're here for the experience. So we've got really creative with some of them. They're more PRN staff or part-time flexible schedules. So some of the things that are hectic, the busy times of the day is in the morning when everyone wants to get up. So instead of them working an 8-hour shift, maybe they're only working a 4-hour shift, and not as often. Or when we have a bunch of transports on the same day, they're taking people on transports, things like that. So the same thing with students. A lot of the facilities around here won't work with people who are in college as far as going to school. Our facility is very open to that. In fact, we have a Mary O'Ganton scholarship, so anyone who's going to nursing school has a chance to obtain that scholarship, and Mary O'Ganton was the matriarch of this family, so that's where that came from. The other is about retaining before you recruit. This was a really hard one for our facility, and it took us a long time. We have a lot of staff that have been here a long time that they're great CNAs, but when we hired new CNAs, they tended to eat them up. Everyone thinks when you get out on the floor, they should be just as fast as me and they should do this. And myself being a CNA, I know that's not how it works. So we really worked with them to, take the time, slow down, to show them that kind of thing. And a few of the CNAs that just persistently were causing chaos, even though they were great CNAs, we actually ended up letting them go. Because sometimes those CNAs who, even though they're great, if they create a chaos or get all of your other staff riled up, it doesn't make the facility run very well. So sometimes it takes losing one or two people to make the overall atmosphere in your facility be better so that you can retain staff and not everyone's leaving. The same thing is said about a nurse. If you have a nurse who's not very tolerant and yells at the staff, the same thing. Even though they may be a great nurse treat the residents well, if they treat the staff that way, nobody wants to work. And you find out then as soon as they know if they're working on that unit with a nurse, they call in. And if you're not able to work with that staff and get them to change, then you're better off getting rid of that staff so that your overall can become stable again. So, same thing with reviewing your training program. We have staff on every shift that we work with to be our trainers, but we need to make sure we educate them on a regular basis well, make sure they're still doing everything correctly. Is there changes that need to be made? So we get feedback from the new trainees as to how it went, and we try to ask. So they may have 2 or 3 different trainers during their trainer. So we try to figure out who says what, how they're doing, because that's another big thing to know, because those first people that work with them is what's going to make your facility either work or not work. I mean, if they're not taught properly right from the get-go, then you know where that happens. You have accidents and those kind of things. So, it's also really important to listen to staff. It's amazing what some ideas, just like falls, for instance, it's amazing how well it is now if you have a huddle after a fall and a housekeeper or even a laundry person who delivers clothes in the room can tell you about some of the residents and, oh, every day they do this at this time and that's when they're falling. It's a wealth of information. So it's that whole core in your building that you need to have everyone included and listen to them and validate their concerns, which is one of the, when I was talking with staff that have been here 15, 20 years, I've asked them, what has made you stay here so long? And a lot of them say, because the owners and the managers listen to us. It may not always come about a change, but they listen to our concerns, they validate our concerns, and they work with us. That and the family-type atmosphere are the two biggest reasons that people stay in this industry. So, and I take that, I mean, as an independent owner, that's a great thing because it's hard in other ways to be an independent owner to survive with all the mega rules and that kind of stuff because we all wear a lot of different hats. So. Trying to flip to this next slide, but it doesn't want to go. There it goes. Since we're in all this competition with everyone around in the community of Jackson, and obviously you got Ann Arbor, and you know Battle Creek and them aren't really hard, you know, that far of a drive for some of them either. That the pay is different. So we have found out though that pay is not always the most important thing. So we started getting creative within the last 5 years or so and doing some different things. One of our big things is we do have an attendance bonus, which is not for every staff, but it is for CNAs, nurses, dietary, housekeeping, and activity type staff. So every 2 weeks for our schedule, if you punch in on time, punch out on time, work your schedule without call-ins, you get an extra 50 cents an hour. And that has been a huge, you know, it prevented a lot of call-ins, everything like that, gives them an incentive. They know they get an extra $40 every 2 weeks. That's been a great benefit that we have instilled. The other thing is we're lucky as we have a massage therapist. We're a full campus that has assisted living. So at least 4 or 5 times a month I'm able to give a staff a massage. So if a family member or a coworker or a family, you know, a resident talks about a staff person that just was outstanding and went above and beyond, those are the people that we reward and do that with. So. The flexible hours is another one. Staffing, you know, right now, the acuity levels in the facility are getting higher, and you still have to watch your budget. So that full 8-hour shift person, a lot of times we're now looking at the halves. So third shift, we met with them all, and they're saying, you know, everyone starts getting up 3, 4 o'clock in the morning, and it gets busier. So we started to have a person who would come to work earlier and work part of third shift and then the first part of first shift. It's not a full 8-hour shift, but they're helping the busiest times to prevent the falls and getting the people up on the end of third shift and then helping with first shift so all the residents are happy, you know, the staff like it because they have everyone here. They're not, you know, 6 o'clock in the morning, they're not worried about, oh my gosh, I got all these people to get up, and today everyone wants up at the same time. How do I do that? This way it gives you a few more hands, makes it a little easier. And then the staff that really like the flexible hours with their kids in that, it keeps them around more. So we already talked about the let them be heard. We do offer ability for promotions here. In fact, we've had a CNA who actually became our billing person. I myself started out in this industry as a CNA, then I became social work, I did admissions, billing, and I in no way ever intended to be an administrator. They just came to me and asked if I was interested, and then I became an administrator. So it wasn't something that I was seeking out. So that's another thing, is empowering your staff and letting them know. Even if you have a CNA who, is great and you want to encourage them to go to nursing school, wow, that's just great when they just stay around and keep doing and going higher and higher. So this next one talks about the longevity of our staff and how long they've been here for our facility. So, and actually I've updated it a little bit more. So we do still have the 41, but I have 55 staff that have been here over 3 years. And for the nursing home industry as a whole now, that's a long time for people, because it's amazing how many people slip in and out of facilities every 3 to 6 months. So 3 years to me is awesome in this industry at this day and age. We still have 21 staff over 10 years and 13 over 20 that are in those areas. We have 6 LPN nurses that have been here over 10 years and 3 over 15 years, and we have 8 others that have been here between 5 and 9. So our LPNs are one of the strongest areas that we have. Majority of our managers that we have here right now are all 10 and above. We do have our own therapists. We don't contract out, and 5 of our therapists have all been here over 5 years, which is a great thing too, because we do have a short-term rehab unit. So that makes it a very positive type thing. I think the RNs are harder for us. In the CNA, we do still have turnover. I won't say that we don't. But I actually have 2 CNAs that have been here over 25 years. And I have a good number that are 4 years and above as well that have been here. But we have a lot of them that are in their first year, and a lot of them right now already are telling us, this is one of the best places I've worked, I want to stay here, and telling us the difference from the other facilities they have. So you need to make them feel like they're part of a team and feel appreciated. We do a lot of different little things. We try to have fun days where they can do things with staff. So when it's Spirit Week or different things, sometimes we just honor the staff. All last year, every month, the managers themselves, not do it at work, but at home, we would pick something that we're going to do. So we would pick a meal, and every month we would do an appreciation for the staff, and we would do it for every single shift. So we would break up in groups, and so maybe on the first month I'm coming in on the first, and the DON's coming on the second, and the HR on the third, and the other staff. But we all just kept rotating, and we would serve them and actually sit down and eat with them and converse with them and get ideas and, hey, what do you see? What changes do you want to see? That kind of stuff. And that was a very positive thing, just to interact. The same thing with having potlucks, since you can make your own food now and raise some of that and do that, is having the staff eat with the residents sometimes, just to get that camaraderie and learn from them. And that's been a great thing. Listening, I instill in all my managers that they need to have an open door policy. If somebody's having a bad day, I keep telling them you have to leave it at the door when you come here, but a lot of times something happens here. I want them to go in an office and vent to a manager and get it out, and then go back to the floor because otherwise it's going to create more problems on the floor. So that's one of the things that I insist to staff. You need to go to a manager, you need to go to somebody, and you have to vent, and then calm down before you go back to the floor. So those are great things in our workplace that has very much helped. So we have had some bonus type structure where, especially sometimes with nurses, if you refer a staff here, then we will, after they stay for a certain amount of time, that we will pay them a bonus. And that's been a very positive way. And generally somebody who already works for you they're going to refer a person that they want to work with which means you're obviously going to get a good staff if that person is already good staff, because they wouldn't want to refer anyone else. So some of the other things that we have done, we do have a safe harbor. We have a 401k that's a safe harbor, and you're vested after 1 year, so that's a great thing. We have 6 sick days a year for people who are full-time, and the benefit of the sick days is if you do not use them, then when it's your anniversary of your hire date, you can cash in your sick days for cash, which a lot of staff really like, especially some of those who are single moms, that kind of stuff. That's been a great one. We do offer medical, dental, vision, just like anyone else. We used to do a employee of the month, but we found out that it's really hard when you have 150 to 200 employees, and it takes a while for everyone to roll around, and it just got where it wasn't quite so. We still do the monthly, okay, it's maintenance this time, and make sure that everyone acknowledges housekeeping, that kind of stuff. So it's very important that everyone participate in that and let everyone know that they are valued and those kind of things. Let's see, what else do we have on here? I think it was a little easier doing this in person than looking at the others. So one of the things that we have been doing for quite a while is we have an all-staff Christmas party. And even the staff that are working on the floor, we serve a dinner and have gifts, but we have them take turns, so managers go over and help cover the floor while they come and have their meal and do different things. But each year we have anything from TVs to gift trees with, cards that have trees that have gift cards on them, fireplaces, snowblower, all different kinds of things, pots and pans, anything like that. So we have a big amount. So for staff that are here, each year you work here, so say you work here 5 years, then when you come to the Christmas party, you get 5 different tickets. And you get to put them in whatever you want to try to win. So the longer you work here, so maybe you've worked here 20 years, you can put all of your 20 tickets in the item for an iPad or a TV or, or the gift tree that's worth $350. And for them, that's a great incentive. And then at that Christmas party, we also do a cash wheel. So anyone who hasn't won those prizes, we draw out their name. They get to draw. We have prizes up to $500 on it. So instantly you could win that. We do put a little twist on it to make it fun, though. So usually they have to do something, like last year they had to dance. So if their name was pulled up, if we pulled them and they had to either do like a break dancing or a disco dance, they had to do it so all of the other staff could watch them and laugh and just have a lot of fun. The owners are there at this party, and it's a great just camaraderie type thing and have fun. So anyone who has been here over 5 years, we acknowledge on a special flyer on the tables, and then we give out name tags. We made special name tags, so once you get 5 years, 10 years, that they call those people up and they get a special name tag that says this many years of caring on it for them to wear, so everyone knows they've been here long, those kind of things. Covered that. So to kind of wrap up some of it, what you really need to do is seek feedback from your floor staff all the way up to your management staff on a regular basis. And whether you do it in your stand-up meetings or you just individually meet with departments, any of those type of things, because this industry is forever changing, and you have a lot of different cultures in your building now. We sometimes have residents who are in their 40s and then ones that are 100, and then you've got staff that are, 19, 20, and I actually have a Cena who's still here who's 73 and is an awesome Cena still on the floor. So there's some big gaps in there. So you have to be very cultured in how you say things to everything, and make sure that your facility activity-wise and person-centered-wise, that they understand the person who's in the 40s and the 50s wants a shower every day, but the elderly ones who are 90s, want a shower once a week if you're lucky. And it's the staff, getting the staff to know that and that person-centered and getting them involved right from the get-go. This resident's being admitted, you go find out from them what is their schedule, what time do they want to get up, what time do they like to go to bed, do they have a particular, as to a tub bath, a shower. It gives them ownership, and then they can pass it on to the next shift and make sure it goes on the care guide. So, and then implementing changes as needed. It's one of those things that this industry is changing rapidly right now. I think some of us are very overwhelmed in this, and that's why that stepping back, acknowledging your staff, make some things fun is what you really need right now to retain the staff. Because if you have if all the managers are constantly just writing policies in meetings and not having feedback, your facility is not going to run very well. They need that. They need to know that they're valued, that what they're saying and what they have to contribute is there. So you can't just sit behind a door, make all these policies and go out and say, this is what you're going to do. You have to let them buy into it and let them be involved in the process. So I think that's all I have at this point. Is there anyone that has any questions for me?
Operator, can we open up the line for questions?
Certainly. Ladies and gentlemen, at this time, if you would like to ask a question, please press the number 1 key. Once again, ladies and gentlemen, if you would like to ask a question, please press the number 1 key.
Thank you. And also, if people are more comfortable, you can also submit your questions through the chat window on the right-hand side of the WebEx window.
We have no questions at this time. Once again, ladies and gentlemen, if you'd like to ask any questions or make a comment, please press the number 1 key.
I have a question. I wanted to ask, do you use like a mentorship program, like they should use CNAs for orientation?
What we tend to do with the people who are newer, it is somewhat of a mentor program because we found that if we pick a newer CNA that we are going to train to be a trainer, and it's a newer, so maybe this CNA's only been here 2 months, we still want to work with them, and it's better sometimes to put them with a newer person than an older, somebody who's been here longer, because they relate a little more and aren't as intimidated, and we have found that that does help, yes.
Oh, so you can put, okay, so rather than just putting with the older person that's been there a long time, you make one with someone who's been there less time but still has some experience.
Correct, because they're not as intimidated by sometimes they're really scared of people who are been here quite a few years, and everyone, it's just the same thing when you have a lot of new staff. We found that if you try to put them in the same unit together, like maybe you had a group of 5 new hires, so if you kind of work them close to each other and not separate them all the time, they kind of, during the orientation they got a little bond going, and so they feel a little more comfortable, so do it in slow increments and have them work, or you put them into the other areas.
Thank you.
We do have a question in the chat box, and it is, what are the various ways that you collect feedback from your staff?
For us, a lot of it is going on the floor and just asking them questions. We also welcome them. They can leave us, they can call us if it's off shift and they can tell us their concerns. We're actually right now getting ready to do another survey with the staff, and we send out surveys periodically that we just ask them questions. And a lot of times we just do it in meetings. So when we have a meeting, we'll call the group together, we'll do so many staff and just asked if they have any concerns, any suggestions. But that's why I said we maintain an open door policy for managers. So like if my manager in the kitchen has some staff that come to him and have some concerns, he'll address them, but then he'll also come to me and say, look, this is what my staff are saying, and if it's something about other people or just something they want to see a change at, that's something as the management team we can talk about and see if we can make those changes happen to make everyone more comfortable. So it's mainly listening and seeking actual feedback from them.
Just a question, other than the recommendations of your staff for hire or referrals for hire, where would you say your best recruitment for your senior staff came from?
Most of our seniors have been recruited by other seniors, honestly, who they say, oh, I know you work there. Some of them, we do have some college students, the students that go for nursing school. So we have people who come here for clinicals, and so while they're in nursing school, some of them that they need to work part-time while they're in school. We've had several of them come and ask if they could work CENA-wise because they have their CENA license while they're in school because they enjoyed their clinical here. They thought it was very comfortable, that kind of thing. So we have Jackson Community College and Baker College that both do clinicals here. The other thing is we use Indeed.com a lot and just put it out there. We try to find the right questions. We're more about looking at personality and character than we are as far as some of their competencies in taking care of people, because people who have good character and responsible, that kind of thing, you can actually teach them a lot of the other stuff. So we do offer a higher wage for people who already have at least 2 years of experience, but even our starting pay is not bad even for new people. So
for nurses, what are some of the challenges that you've had with hiring or recruiting nurses, and how have you been able to overcome those?
I think the biggest problem we have is the RNs. We do have several RNs, but RNs are really hard. The local hospital here Allegiance is a hospital here, but they just merged with Henry Ford Allegiance and are kind of expanding somewhat. So we're really having a big struggle competing with the wages. And the fact that a lot of them there can work 12-hour shifts 3 days a week. We looked at doing that in our industry, but we have a lot of nurses here that don't want to do the 12 hours 3 days a week. They think that's a burnout for them. So that is one of ours. So right now, that's one of the things we're working on right now, is trying to recruit more RNs, and we actually have a meeting the end of this week with some of the nurses again to do some more brainstorming to figure out how we can recruit more RNs. That is one of our biggest, that's where we only have about 5 RNs here that have been here over 2 years. I do have a couple that have been here 20 years, but then we're just, those that are down there that's our biggest struggle in this realm right here because of the number of healthcare facilities and then the people driving to Ann Arbor.
So does it help, like, if you said you're having the community colleges near you doing your clinicals there, are you able to recruit from those people?
We are able to recruit from those people, yes. Yes, we have hired people that have came here for clinicals, yes.
Yep, kind of as a follow-up to that, in the chat we had a question about how do you deal with competition in your local area?
I mean, that's why I said there's always going to be here. So the things that we talked about is, some of the things that we do as far as listening to the staff, making them be an equal to us, involving them in decisions. I think that's one of the things that helps us with the competition, because some of the people who come here from another facility said, I've never even met the administrator, or, I ask questions, but I never get answers, those kind of things. So I think it's that availability of the owners and the administrator and the manager people that's who they really want to hear from and have feedback from. Just like the millennials, they're new. They want feedback. So if you are someone who only goes and talks to them periodically, those new millennials, you need to touch base with them every week for like 3 months. That is what they really want. They want to know, am I doing a good job? What is this? That is it takes more time. We're lucky to have a great HR director. She actually came from a staffing agency, so she was very astute at dealing with a lot of different things, but she's awesome at doing a lot of those things and touching base with staff. You have concerns and then coming to the director of nursing and myself, and then we can have meetings regarding whatever it is. So I think it's the feedback and the time that you give them in listening and letting them validate them and acknowledge them.
Once again, ladies and gentlemen, if you would like to ask a question, please press the number 1 key. We have no questions at this time.
Okay, this is Kathleen again, and I'd like to thank you for joining us today for our webinar on staff retention from an independent owner's perspective. The recording will be available on our LS2IN YouTube page within the next week. And at this time, you will get an evaluation questions to answer. Please take a moment to let us know how we did by filling these out. Thank you, and have a great rest of your day.
Thank you, everyone. Have a good day.
Thank you, ladies and gentlemen. This concludes your call. You may disconnect at this time.